If you've ever taken a fall or bumped into something, you'll know the immediate response of your body is pain, inflammation and bruising. The application of an ice pack will give immediate relief as it reduces bleeding into the tissues, prevents or reduces swelling and inflammation, reduces muscle pain and spasm, and reduces pain by numbing the area and limiting the effects of swelling. ACTIVE650 has a selection of products available here which are perfect to keep at home for when accidents happen. When you are rehabilitating an injury, movements and exercises are frequently required to restore normal function. These can often be painful, so ice is used before and during treatment to reduce pain and muscle spasm, making movement around the injury more comfortable. If you are given exercises to perform at home between physical therapy visits, we suggest you keep an ice pack on hand to alleviate pain and discomfort. ACTIVE650 has a selection of products available here which are perfect to keep at home. Ask your physical therapist if ice is right for you. Ideally, you should apply ice as soon as possible to an injury for the best benefits. Apply for 20 minutes and then reapply every 2 to 3 hours thereafter for the next 24 to 48 hours as needed. Be careful not to apply the ice pack directly to your skin, especially if it's broken or there are stitches. Use a tea towel or something similar. Ice causes a longer lasting effect on the circulation than heat, and the pain-killing properties of ice are deeper and longer lasting than heat. Store in the refrigerator or freezer until needed. ACTIVE650 ice packs available here are particularly good as the beads mould around the injury for maximum effect even when frozen. We at ACTIVE650 have designed our hot and cold packs to be anatomically efficient. The thousands of tiny beads move against each other even when frozen, meaning that the pack is always soft and pliable. This way the pack can mould around the body's contours, resulting in a greater surface area in contact with the injured area. The packs come in a range of sizes so that you can be sure that there's one that best fits your injury wherever it is. Please ensure that you follow the instructions on the back of the pack. Do not use heat on a new injury as it will increase bleeding around the injured area and may make the problem worse. The exception to this is new onset low back strains. A lot of the pain in this case is caused by muscle spasm rather than tissue damage, so heat is often more helpful than ice. Once an injury is older than 48 hours, heat can be applied to encourage the blood vessels to open wide. This brings more blood into the area to stimulate the healing of the damaged tissues, and it has a direct soothing effect which helps to relieve pain and spasm. It can also ease stiffness by making the tissues more supple. Be careful when handling the hot packs not to overheat them and cause burning to the skin. ACTIVE650 offers a range of multi-use packs available here which can be used either hot or cold as needed. ACTIVE650 hot and cold packs come with easy to use instructions on the back. For the cold, you keep it in a freezer or a refrigerator, and that means it's ready for immediate use. The ACTIVE650 packs contain beads which remain separate and pliable even when they're frozen, so they can mould around the injury more effectively. It's best to wrap the pack in a cloth before you use it to protect your skin. For a hot pack, the pack can either be immersed in hot water or quickly heated in the microwave oven for about 60 seconds based on an 800 watt oven. Be careful removing the pack, and again, use a cloth to protect your skin. A selection of products is available here, so ask your physical therapist which one is best for you. Resistance bands are a great rehabilitation tool that aid strengthening, coordination and range of motion. The unique stretch provided by the ACTIVE650 resistant bands gives a smooth expansion and contraction and prevents bounce at the end of the stretch. Your physical therapist will advise you on the correct thickness of band to use and also provide you with the appropriate exercises that will speed your recovery and have you back to full fitness in no time. There's a range of thicknesses, so there's a band for everyone. ask your physical therapist for further information.